So today we're going to be talking about emergency first aid and what you can do to help somebody out.
So, what is first aid?
First, the thing you do when someone is hurt or sick.
What you must do immediately.
You may be the only one there to help.
Don't move a badly hurt person unless they are in a dangerous area.
Okay, so this is what you do if you are bleeding or if somebody else is bleeding. First, direct pressure. And if for some reason this soaks through, just keep adding on top of it. And if that keeps soaking through, just keep adding. And when the ambulance shows up, they have a fun bag of tricks and tools that they'll use, but direct pressure can help stop the bleeding or slow it down enough so that way the ambulance can get there and help can arrive.
Becca, are you okay? Are you choking? Okay, if you're choking, you may not be able to talk, and so you're going to be doing something like this. You'll see somebody doing that. And if they leave the room because they're embarrassed or something, follow them out because you want to make sure that they're okay. And one thing you can do, let them cough it out. If they can cough it, that's the very best thing. Becca, can you cough and get that out of your throat? Okay. So she's going to need some help. We're going to do the Heimlich maneuver. Okay, let's step over here. And so, yeah, right there. And I'm going to put my hands together and put them about her belly button, and I'm going to push up. And I'm not going to really do it to her because if you do it to someone who isn't choking, you could really hurt them. So I'm going to push up like that, hard and fast, so that try to get that out. Cough one more time. Okay, she is good. All right, thank you. And if something happens, you're alone and you're choking, you can do the Heimlich maneuver to yourself. It's not as good as having someone else, but if you're alone, that's what you can do. Get a chair. And you're going to put it about the same spot where where I put my hands on Becca there. And you lean on it and you push, kind of push up with the chair, and you should be able to help clear your throat then. Once again, try coughing first.
Okay, and now we're going to talk about splinting. So, like I said, when the ambulance shows up, they have a fun bag of tricks that they can use to help splint. But if you're at home, you can use some alternative things. If you have a paint stick or a ruler, a wooden spoon, plastic spoons, or popsicle sticks, you can make a splint. Now, depending on what you're wanting to splint, you can rip off a portion of your clothing and use that as a tie. So, if we're going to splint her wrist, because that's broken, I'll have you use your other hand to hold it. And then you just wrap it around. Nice and easy. You don't want to wrap it too tight because then you can cut off circulation. But you'll wrap it around and then she can't bend her wrist. And then you'll make sure that she can still feel you touching and she can still move her fingers if she was able to do that beforehand. And then if she were to hurt her finger, you can take popsicle stick and Band-Aid and you can just bandage that around so that way she can't bend her finger. And then you can go to the hospital to have it checked out. CPR. Coming? And this is what happens when somebody is unresponsive. So what you'll want to do is if you find this person laying on the ground, hey, are you okay? They don't answer. So Becca, I'm going to have you call 911. So you want to see if they're breathing, see if you can feel their breath coming out of their nose or their mouth. Look and see if they're moving, and if they're not, then you'll want to start doing chest compressions. So what you'll do is you'll find there's a little bone area right here, and you'll go right there, and you'll push hard and push fast. And you'll do this, you want to do this 100 times a minute. Now I want you to try. Oh, come a little closer. Put your arm like this and put your hand on top. There you go. Okay, now Joseph, I want you to try. So they're, oh, yep. Gotta push down really hard. So it's really important that you do compressions, so that way the blood continues to pump. But whenever you go into like a school or a church or a shopping mall or any kind of place, look for an AED. It's a little machine about this big, and it has instructions inside that say how to put the patches on and what to do. But somebody should always call 911 if they find somebody that's laying on the ground unconscious.
Tomorrow we'll be talking about some more emergency first aid things and some things you can do to help out folks.